Welcome to TMI, Talking More About It, a podcast by Henry Ford Allegiance Health. If you haven't heard this show before, it's a little bit, I'll give you a little bit of a description about it. Us here in the marketing department at Henry Ford Allegiance Health are on kind of a quest to become more healthy. We're interested in health topics that kind of give us a better, what would you say, Andrew? A better kind of life experience?
Living experience and just relatable health topics. Things that not only we think about and experience, but we have a pretty good feeling that you might too.
Yeah. So that over here is my co-host, Andrew, and he is joining me today to talk about a really interesting topic, something that he has some personal experience with. What's that topic, Andrew? A
little too much experience, really, but just back pain, low back pain specifically.
Mm-hmm. Yeah. So this was something that you kind of got into a little bit a couple of years ago. Can you tell us your experience?
Yeah, I got in a little too deep, to be honest with you.
You sneezed?
That was the final blow, believe it or not. Just a sneeze.
Yeah.
But yeah, I was experiencing low back pain for roughly 8 months, and it progressively got a little more aggressive, and I noticed my flexibility, my strength, all those important things were being limited and becoming less and less of an option for me. So, the final decision was to get a back surgery, a microdiscectomy. And fast forward 4 years, I'm feeling great, healthy, and I'm extremely happy I made that decision.
You were even able to help me move some of my furniture when I moved a little bit.
Yeah, all 15 of your guitars.
Yeah, I have too many guitars. But, yeah. So, and I think this is a topic that we all are interested in. I mean, at times if you kind of stress out your back a little bit, it's good to know some nice tips about how to make sure you're in shape and get back on track with what you're doing. So we have this special opportunity working in a hospital here. We can, basically talk to some of the brightest minds in medical fields.
We know people.
It's kind of like when you're at like a dinner party or like an event and you see that one doctor over there and you're like, oh man, if I had 10 minutes to ask him anything, I would have so many questions.
Right.
Well, we do. We have a few more than 10 minutes. One thing we want to talk about, though, is that this is just information. If you need specific medical advice, please consult your own doctor or physician for more information. So we have in the studio today Dr. Basheer. Welcome.
Thank you so much.
Yeah, could you kind of introduce yourself, tell everybody a little bit about what you do and kind of your experience?
Thank you so much for having me. It's always a pleasure to be here. I'm actually relatively new to the family of Henry Ford Allegiance Health. I did spend a lot of my training, actually 7 years of residency at Henry Ford Hospital. Came in, it was a smooth transition to be actually part of this Henry Ford Allegiance Health family and the community, but he's been welcoming, and a lot of what I see and specialize in is spine surgery, minimally invasive techniques to get people back on their feet quicker, with small scars, minimal pain after surgery. And the same token, I definitely also address patients that come in with bigger spinal deformity, problems which require more extensive surgery. But it is a nice balance to be able to address both aspects of, minimally invasive spine surgery and big deformity spine surgery.
Yeah, that's really neat. So an example like Andrew's, it's pretty obvious when he can't get out of bed. He needs a little bit of work done. He needs to be fixed a little.
Right.
But how do you know when it's time to go in and get looked at and find out what can be done?
That's a good question. Let me just backtrack and just give you a little bit of background about spine. I mean, the human spine is a complex structure made out of bones, discs, ligaments, muscles, and nerves. Anytime you have an injury, an inflammation to one of these components, you end up with back pain. It is quite a prevalent problem. Actually, it is the number one cause of disability, not
Wow.
just in the U.S., but worldwide. And with that being said, about 80% of the population will experience some sort of back pain during their lifetime. And the good news is not a big percentage, actually a very, very small percentage of these patients with back pain require surgery. Most of the time, pain improves spontaneously without you having to do anything. This would be the case if you sprain a muscle. If you give it a few days of rest, some icing, that gets better on its own. In cases where the pain persists for a few weeks, and you've tried and exhausted all the conservative measures that we have, which include physical therapy, medicines, massages, chiropractic manipulations, and you're still having quite a bit of disability, quite a bit of pain, you're unable to perform your daily activities or go about doing your work, this is the time that you need to come in and see a spine surgeon, and at which point you'll have that discussion of whether you need surgery or not. And surgery should never be taken lightly. Decision to have surgery should never be taken lightly by the patient or the physician. So,
Yeah, it's kind of amazing to think of something that's so important and central to your well-being or living or mobility. What it's made of. It's just like it moves all the time, and it supports your entire structure. So it's kind of wild that it works, and with how much people don't sit properly these days and sitting in front of computers, and just it's crazy that we can still walk around.
That's true. I mean, there are definitely things that you can do to prevent back pain. We can talk about that.
Yeah.
Essentially starts with eating a healthy, balanced diet. A lot of the studies suggest that, healthy diet rich in vitamins B, D, and E can definitely improve bone health and reduce inflammation. Staying active is another key component to back health. You never want to be bed bound. We don't recommend bed rest for more than 2 days these days. You definitely want to be active. Things like yoga, things like that involve cycling, or things that involve strengthening your back and core muscles definitely help keep back pain away. Anytime you have issues with weight gain, especially around the midsection, you can definitely shift the center of gravity, and you put more stress on those joints and bones and discs in your back. So you want to avoid weight gain. Another thing that you can do to prevent back pain is if you're a smoker, quit smoking. Smoking is not only associated with bad things when it comes to lungs and heart disease, but can definitely limit the amount of blood supply and nutrients that are getting to your discs and bones. And posture, like you mentioned, you want to be cognizant of that. If you're sitting on the disc job all day, you want to just get up, stretch, walk around. Sleeping posture also, if you don't have a comfortable mattress or a pillow that's too high, that can definitely lead to back pain. And small things like, an overstuffed wallet can definitely shift your posture, cause some pressure on, the sciatic nerve, as some people would say.
Right.
So all these things can be done to prevent back pain.
Yeah.
And so you've mentioned discs a couple times. Do you think you could just explain a little more what a bulging disc is, or a herniated disc?
So discs are the pads that act like cushions between the bones and the spinal column. They're designed like a jelly donut. That's what I usually tell patients. So they have a soft central core, what we call the nucleus pulposus. That's the shock absorbent. And that's surrounded by a tough, thickened wall. Anytime you have an injury or weakening of that tough wall on the outside, you can have some of that soft jelly component ooze out, or essentially herniate out the disc. That in itself causes quite a bit of back pain. And that herniated disc that oozed out can definitely irritate the nerves, put pressure on them, and that's when you also get the sciatica or the leg pain that people come in with as well too. And I suspect that's what you had, Andrew. And
Quite a bit of it, really. It was, it started high, and over time it crept all the way down the side of my left leg, down to my toes.
And, you mentioned that you've lived with that pain for 8 months, and you would have been like an ideal surgical candidate, which, after having that surgery, sounds like you did phenomenally well.
Yeah, absolutely. It was, the recovery for me, it takes time, it takes patience, but the relief you get almost immediately from the corrective surgery that I had was pretty remarkable.
Yeah, you were saying earlier you were like ready to go the next day. Tell us a little bit about that.
In a nutshell, I was injured for about 8 months. Because surgery is an important decision, and I was 32 at the time, so I was a little bit on the younger side. I was encouraged to try physical therapy, massage, yoga, but as it got worse, my flexibility and just my strength in general started to decrease. So I made the decision to have the surgery in September, and it went well. And I would say by late October, 6 weeks or so, I was already back in physical therapy, feeling strength coming back, comfort, walking, resumed working. So yeah, everyone varies, but for me, it was a pretty quick recovery.
Well, that's great.
Yeah, you mentioned physical therapy a couple of times. I mean, physical therapy does play a vital role in spine health before and after surgery. You'll notice that physical therapy definitely helps alleviate back pain, maintains your flexibility and mobility, and improves function. It could be what we call passive physical therapy, which involves things that can be done to your back, such as massages, ultrasound, heat therapy, or electrical stimulation. Or it could be more on the active physical therapy side, where you can actually do, where it focuses on stretching and exercising those back and core muscles.
That's great. So it sounds like your back is something you really want to take care of. Do you know of any routine things you can do to keep your back in shape? Do things like supplements work, or activities that you can do continuously to kind of keep that most important spine thing working?
That's a good question. Like I mentioned briefly before, some of the things that you can definitely do include, a balanced diet, such as, focusing on a lot of greens and vegetables. The vitamins, the studies that have linked vitamin B12 and vitamin D to less inflammation and less back pain. The other things, like I mentioned, posture, proper sitting, avoiding being in a stooped or hunched over position for too long. Even when you're typing, the ergonomics of your office space, and this can definitely affect your spine health and, neck pain as well too. So all these things that we do, and exercise, obviously staying active is key. Some people enjoy yoga, which focuses a lot on core muscles and abdominal muscles, and that's what you want to strengthen ultimately, your muscles, so they can, distribute the weight off the discs and bones that ultimately degenerate. So you want to develop those muscles, and doing things like setups, doing exercises, on a medicine ball and things of that nature can definitely, even 15, 20 minutes a day can definitely decrease your back pain.
So that explains why you have a stand-up desk, Andrew.
Absolutely.
And one of those sitting ball things.
Yeah.
I thought you're just being different.
I am a little different, but the ball was huge. I think that was a good tool in keeping me active while sitting and working. Yeah. And then I think I really made some progress when I ditched the ball and the desk altogether and just stood up, because that at the end of the day made a world of difference to the amount of pressure that was relieved from my low back just from standing. Yeah. And you adjust to it pretty quick. Like the first 3 weeks, my legs were a little tired by the end of the day, but now I feel comfortable with standing.
So we should be standing for this podcast.
We Actually, I should probably stand up here in a minute.
Or if you're listening to the show, you can walk around.
You should definitely be standing while listening to this show. Part of this show is also, in addition to giving tips and health stories, just making people feel comfortable in a situation that they might be feeling. So do you have any words or just insight from your perspective that you could give to someone that is going through back pain, in terms of success or recovery, or even just technology? I mean, and how much treatment for back pain has improved or evolved over the last decade, we'll say.
I mean, for sure, spine surgery has evolved quite tremendously, especially in the last decade. I mean, the techniques that we've developed over the last few years, actually, and still developing, have advanced our understanding of spine and spine health. The good news is we have a comprehensive spine team actually at Henry Ford Allegiance here that starts with physical therapists, physiatrists, pain specialists, and neurosurgeons as well too. And you mentioned what things or how do you start that journey of back pain treatment? It all starts with seeing your family provider. So if you're having issues with back pain that hasn't improved with just some icing, some over-the-counter medications like ibuprofen or Tylenol, it's not a bad idea to go seek attention, medical attention at your family physician or a family provider. The things that you want to start with, especially someone who's young, you want to start with physical therapy. We mentioned how physical therapy plays a vital role in spine pain alleviation and maintaining mobility. And the younger you are, the healthier you are, the better outcome you'll have when it comes to physical therapy. If that fails, you move on to the next step, which would be to see someone at the pain clinic or physiatrist, at which point they can talk to you about your medication options. Opioids, especially with the opioid epidemic, are not a good option anymore, and we're realizing that more and more. So you want to avoid being on opioids for any extended period of time. And seeing someone at the pain clinic, they can talk to you about your options, which usually involve things like an injection. You've heard about maybe epidural steroid injections. Basically, they give you some medications to take down the inflammation in the spine, alleviate some of the irritation in these muscles, ligaments, and tendons that I mentioned, and nerves. That has a good chance of working. Actually, most patients with back pain spontaneously resolve with some of these things that I mentioned. Over 80% of them improve without having to need surgery. If all those things fail, what we call, we've exhausted conservative measures, we've tried all there is to try outside of surgery, then surgery becomes a viable option. And when you talk about surgery, there's a wide spectrum of surgical procedures that can be done to the spine, and it all depends on the degree of pathology or disease that someone presents with. In most cases, if it's a simple herniated disc, at one level, you can definitely do a minimally invasive approach called a microdiscectomy. It involves a 1-inch incision, 45-minute surgery. Patients usually go home the same day, and they get tremendous relief almost immediately after surgery. It's always satisfying to see someone after surgery wake up and they can say, "Doc, I could feel my toes for the first time in a long, long time."
Wow, absolutely. Yeah, that's one of my favorite memories. And it's it was a tough situation. A lot of pain was involved. It was tough on my family. But that moment when I stood up for the first time and walked, it honestly brought tears to my eyes, because there was just so much worry prior to it. I'm 32, I can't really walk, and I just went out, had the surgery, and that relief was incredible right after it.
That's good to hear. And like you mentioned, with these microdiscectomies that you can do, patients are usually back up on their feet that same day, and they're usually back to work in 2 to 3 weeks. This is a bit different in contrast to some of the bigger cases that we have to do in cases with what we call completely degenerated disc, where the disc with time essentially disintegrates and disappears, and you end up with that severe back pain that's usually due to what we call the bone-on-bone pain. That involves a bit more surgery. Nonetheless, most patients are usually up and happy and active at the 6 weeks mark. They're back to work, doing well, and that's a different surgery than what you had, but it is something that we definitely do quite frequently here at Henry Ford Allegiance.
Wow, that's pretty neat. Lots of new stuff going on, lots of options, and anybody who has pain there's no reason they shouldn't be scared or should be scared. It's just a normal thing. It happens to everybody.
It is quite common and prevalent, but like I said, the decision to have surgery should never be taken lightly, and should definitely be an option or one of your last options, and that's what we strive to do at Henry Ford. And despite having the latest and greatest technology and being the first to pioneer robotic spine surgery here in Michigan, we still take a conservative approach when someone presents with back pain. We give them the benefit of the doubt. There are obviously some exceptions if someone comes in with weakness in the legs or incontinence. That usually pushes a timeline a bit. Yeah.
Great. Well, that's some good information.
Very great conversation. It's been a few years since I had this surgery, so to speak to an expert about it after I've already gone through it and in a good place now, it's a nice conversation to have.
Great. Well, thanks for joining us today, and it was really great to get your insight into all these interesting things that are going on. For our listeners out there, if you want to find more of these shows, they are online. You can join us on Facebook to find out exactly when we'll be putting out new ones. And it should be listed in all the places that you normally find podcasts. So thanks for being part of this. And if you want more stuff, our website is henryfordallegiance.com. And thanks for joining us.
Thank you so much for having me.